Hello everyone, I'm Andrea from Andrea Davis Cancer Coaching, and today I'm going to show you how to use EFT tapping for cancer-related pain. Now the beauty of tapping is that it's something you can do yourself, it's completely free, and you can do it anywhere at almost any time. Before I dive in and show you how to do this, I'm going to ask you to like and share this video, subscribe to my channel, and if you want to stay updated about my new videos and about special offers, go to AndreaDavisCancerCoaching.com and sign up for my email list there. Now, EFT is also called the Emotional Freedom Technique, or tapping. So it involves tapping on energy meridians, which are the same ones that are used in acupuncture. And I'm going to walk you through exactly how to do it in just a minute. Now, even though it may look and feel strange at first, the results can be remarkable. So please put any skepticism that you may be feeling on hold and give it a try. This video is only a few minutes long. It's just enough to cover the basics. If you want to go deeper, there's a whole book on this topic called The Tapping Solution for Pain Relief by Nick Ortner. I'll put a link to the Amazon link for the book in the resources section of my blog post. And the link to the blog post will be in the video description. So you're also welcome to schedule a free discovery session with me at AndreaDavisCancerCoaching.setmore.com so that you and I can go more in depth about how to use tapping for your particular problem. Now, I want to mention that EFT is very effective for many emotional issues as well, and I'll be making a video next week about how to use it for anxiety. But for right now, we're going to focus on using EFT for physical pain. So step one of using EFT is to clearly identify your target. And your target is whatever problem that you want to focus on, that you are looking to solve. So in this case, it's what's hurting. So just take a moment and identify exactly what is hurting for you, whether it's back pain or stomach pain or a headache, whatever it is, and then give it a number on a 0 to 10 scale, with 0 not being painful at all and 10 being the worst pain you can imagine. So just maybe you could write down that number, just really have that number firmly in your mind. How painful is it? So now we're going to start. You're just going to start by tapping on the side of your hand, and this is called the karate chop point. It doesn't matter which hand you use, you just want to be tapping right there. And you could switch back and forth too, that's fine. And you're going to say, even though I have this pain in my body, I deeply and completely accept myself. Even though I have this pain in my body, I deeply and completely accept myself. You say it a total of 3 times, so one more time. Even though I have this pain in my body, I deeply and completely accept myself. And that's what we call the setup. And now we're going to tap on all the points. And on this first round, while you're tapping, you're going to really just tune into this pain and how painful it is. So with tapping, it works best to focus first on the negative before we move to the positive. So the first point is the eyebrow point. So it's just inside the eyebrow here where the hand where the hair ends and meets the nose. So you can use one hand or the other or both. I like to use both. You can just tap 5 to 7 times. I like to tap 12. I'm kind of an overachiever. Okay. So it doesn't need to be exact. You don't have to do this exactly right, but this is what you do. You just want to tap right here. So, and then you're focusing on it. So you're saying this pain in my body, this pain in my body. And then we're going to go to the next point, which is the side of the eye. So not your temple, but that bony place right where your face turns. All this pain in my body. And then we go under the eye. This pain in my body. And the next one is under the nose. All this pain in my body. Next point is just below the lip. This pain in my body. And now we go to the collarbone point. So you want to feel for those 2 collarbones, and you're going to go an inch below and about an inch out. And you can tap with all 10 fingers here. I like to do that. This pain in my body. And now you're going to tap under the arm. You can do either side, it doesn't matter. So it's about 3 inches below your armpit, or just about at the bra line for women. this pain in my body. And then you're going to tap at the top of your head, all this pain in my body. And that's one round of tapping. So now we're going to do another round. So eyebrow point, all this pain in my body. So frustrating. I'm really frustrated about all this pain in my body. And I'm ready to let it go. I'm ready to let this pain go away, out from my body. I'm ready to let this pain out. Let it go. Let it go into the universe. I'm totally ready to let this pain go. I'm ready to let this pain go. And now you want to take a deep breath in and a nice long exhale out. So after each maybe round or two of tapping, you take a deep breath and see what's shifted. So if your pain was at a level 8 when you started, is it still there? Has it changed at all? And check in with yourself to see if any thoughts or emotions have come up. Like maybe you have a lot of, if you have fear coming up about a scan, or if you have a thought coming up like I really need to start exercising, or if you have a thought come up like, gosh, I'm experiencing a lot of challenges in my relationship, or emotions coming up about that. So as we go through rounds of tapping, we may experience shifts in our thoughts and emotions that come out of deep intuition and may have to do with the mind-body connection. And it's important to really pay attention to these. So if you have a new thought or emotion, you may want to incorporate that in your next round of tapping. So to work through an issue properly, you want to give it at least 15 minutes of tapping. And so it can really help to set a timer and promise yourself not to stop tapping until those 15 minutes are up. And if you're not sure what to say in the next round of tapping, you can simply affirm that you're ready to release this pain. That's a fine thing to do. I'm ready and excited to release this pain into the universe. Completely ready to let go of this pain that I'm feeling. Or you could go in a different direction. Like I'd like to understand this pain. I'm open to understanding what this pain is. I think for me, I would want to just say, I'm ready to let this pain go. That's probably what I would do. But you do whatever feels right for you. And so as we go on with the rounds of tapping, we are affirming what we want to have happen. So tapping helps create shifts and movement and new energy flows that can result in new thoughts. And I suggest that you really maintain an open and inquisitive state of mind and just see what happens. And most of all, see if 15 minutes of tapping helps alleviate your pain. And you could really get into it like, you could be like, I am ready to let this pain go now. I'm ready to release this pain. I'm ready to have this pain gone from my body. You could put some emotion behind that if that feels right to you. It's really, can be a creative, expressive thing. And exactly what you say and what you're thinking and feeling as you do your tapping is really up to you. So now, of course, tapping, I just want you to see what happens and to see if 15 minutes of tapping helps alleviate pain. I'll be really curious to hear if it does. Now, of course, tapping is not at all a substitute for getting good medical care, including scans and other diagnostic tools to help understand your pain, but it is a great complementary tool that you can use alongside your medical care. I hope this was helpful. Again, please like and share this video and subscribe to my channel, and you can sign up for my email list at AndreaDavisCancerCoaching.com. Please take good care of yourselves, everyone. I hope this was helpful, and I'm sending you all my very best wishes and my love. I am wishing for all of your good health, and I'm looking forward to seeing you next time. Bye-bye for now.